Organizations across the world have been left in a state of limbo after President Donald Trump ordered a sweeping freeze on foreign aid in January. In 2023, the US was the largest source of foreign aid in the world, with USAID disbursing roughly $45 billion to international programs. The abrupt decision is already having serious repercussions. In southern Mexico, the Swiss NGO Doctors of the World has warned it may soon be forced to cease operations, leaving thousands of migrants without critical medical care. Our correspondents Laurence Cuvillier and Mathieu Command filed this report for us.
La salud es un derecho de todas las personas. Para nosotros no vemos religión.
A quick reminder of the core principles of Doctors of the World is provided before consultations begin. We're outside a migrant shelter in Tenosique, near the Guatemalan border. Most of the migrants here have trekked thousands of kilometers in perilous conditions. Respiratory illnesses are common, along with tropical diseases like dengue fever.
También otro de los ejercicios que habíamos estado practicando es solamente en inhalar por 3
But many
segundos.
also need psychological support.
It's mentally draining. Your mind races. So many people disappear along the way. I made the journey alone. People kept asking who I was, where I was going. I stayed silent.
But with these brutal funding cuts to USAID, this lifeline is now at risk.
Nosotros también tenemos una responsabilidad con los usuarios, con los pacientes.
We have a duty to our patients, stopping everything overnight, especially when we're treating severe cases that need ongoing psychological care. Telling them, sorry, we no longer see you. It's like abandoning them.
From migrant support to combating gender-based violence and access to abortion, many of the NGO's core principles now directly clash with the current US administration's political agenda.
We had commitments. This was a project meant to run until 2026. To shut it down in 24 hours, to cut funding overnight, it's beyond irrational. Doctors of the World has been fighting for greater social justice for years. Now we're seeing the exact opposite. The entire system of international cooperation and solidarity is being undermined.
The NGO has decided to continue operating using its own limited funds until the end of April. But without new backing, it's unlikely they'll continue much longer.
Well, for more on how the cuts at USAID are affecting the activities of NGOs in Mexico, I'm pleased to welcome Antoine Lissorgues, the General Coordinator for Doctors of the World Mexico. It's such a pleasure to have you with us on the program today. We heard a bit about your NGO in that report just there, but give us an introduction to the work you do at the organization.
Yeah, what we do in Mexico, we have a mobile clinic. We have different kind of interventions. Migration population, migrant people. We have primary health care. We take care about different kind of disease, but mainly skin disease, respiratory disease. We have another area of mental health care and health promotion. And one of the last and very important area is the gender-based violence management. We have manager. We care of this case because on the road we know that a lot of migrants are victims of sexual assault, sexual violence.
So on top of the sectors you just mentioned there, the funding cuts also affect work in domains like human rights, anti-corruption, and environmental protection, to name a few. Could you give us some concrete examples of how the cuts would impact the initiatives in some areas? I mean, help us get an idea of the gravity of the situation.
Yeah, the situation is really difficult because on the road people can be victim of a lot of stuff. We know that now the cartel, traffic are in charge, or people are in charge, traffic smugglers are in charge of the human trafficking. So it's really difficult, our intervention in this context, because we have to protect people. We have crossed a lot of country. Who are victims of how I was saying, sexual assault or different kind of problems like this.
Now, in a broader context, these foreign aid cuts not only harm individuals in Mexico, but also undermines the current administration's efforts to address issues like migration and crime, doesn't it?
Sorry, could you repeat?
I said, the foreign aid cuts not only affects individuals in Mexico, but also undermines the Mexican government's efforts to address these issues.
Yeah, the cut is terrible because we have to, maybe at the end of the April, we have to stop our intervention. And we know that in Mexico, it's difficult to get funds from the Mexican government and from other organizations.
Now, it's obviously a blow to humanitarian organizations supporting refugees in Mexico, coming at a time when obviously new US border policies have increased demand for their services. But paint us a picture of what's the situation like in Mexico at the moment?
The situation with migrants people in this moment?
Yes.
Yeah, now we can see the flow are reducing because people now, it's difficult to go to the northern border of Mexico because with the new politics, it's difficult to cross the border. So many migrants that we care are looking for to go to Mexico City, because in Mexico City they can apply for asylum, they can have more services, access to a job. So this is like a new dynamics, or other migrants wants to go to, or wants to come back to their origin country. So people wants to return, and they have contact with consulates, but it's really difficult because we have many people who had access to CBP1 system to go to the United States, and now the government canceled this system, CBP1, so they are in Mexico with any chance to go to the United States.
And how are NGOs, including the one you work for, Doctors of the World, Ms. Saint-Dumont, coping in the face of all this? We heard in that report earlier that without funding, it's unlikely that you'll be able to continue much longer.
Yeah, really, we have funds from an agency which name is BPRM, Bureau of Population, Refugee and Migrants from United States. It's part of the State Department. They cut our funds in 24 hours. So now we have take a decision to continue with our intervention with funds of our HQ in Switzerland. But really, after the last week of April, we are not sure to have the possibility to continue with this project, because we have to look for new donors. We are waiting for a response, for example, of the European Union from ECHO, the Humanitarian Affairs, the Humanitarian Office, of European Union, but nothing. It's really sure in this moment. And as we know, we have a lot of countries now, not just United States, which are cutting in the international aid development funds.
Antoine, unfortunately, that's all we have time for, but it's great to hear your thoughts. Thank you so much for your time today.
Thank you to invite me.
You're watching France 24.